the skeleton, and what to know for your level 2 anatomy and physiology exam. Hi, I'm Hayley from Parallel Coaching, and in today's video we're going to explore the basics of a checklist of what you need to know ready for your level 2 anatomy exam, just for the skeletal system and that type of section, all about bones, joints and types of bones. So in order to know this, before we get started, I just want to let you know there are 3 mock questions that will test your knowledge on today's content. All you need to do is scroll down and you'll be able to find those questions straight away. Now let's dive into how many bones there are in the body. This is the first thing you need to know. There are 206 bones in the body, and this is not just here as some trivia fact, but it might come up in your exam. But it also gives context for actually how many bones you need to know for your exam. It's quite few in relation to all of the bones in the body. For level 2, it's GCSE level, so we need to know a foundational basis of the bones and how to use those as bony landmarks when we go on to learn the muscles. So it's about having a general understanding. We don't need to know all 206 bones. But there are 2 skeletal systems. So although we go, oh, it's one skeleton, there's actually 2 skeletons that make up our whole skeletal system, and we call this the axial skeleton and the appendicular skeleton. Now, I'm not going to go into huge detail of these today. All you need to do is click the link that I'm pointing to, and that basically will take you onto another YouTube video I've done that shows you all about axial and appendicular skeleton in much more detail. And you're going to understand exactly what these are and have examples of the bones that appear in each of the skeletons. So this is going to really help you. Plus, there's a really easy way of remembering the difference between the 2. Outside of that, you also need to know the different bone types. So there are long bones. Now these are longer than they are wide. So like our humerus in our upper arm or our femur in our upper leg. Then you've got our short bones. Now these short bones are basically usually square-like. So they're short as and they are rather than long. So we have the long bones and now we have a short bone. Short bones are things that you'll find in your carpals or in your tarsals. And these are basically short little square bones, basically. Then we have flat bones. Now, flat bones are really good for attachment points for our muscles. So you're going to find these with the scapula, with parts of the pelvis. And these flat bones, like I say, are great for attachment points rather than necessarily allowing for mobility or motion. So they're great for stability and attachments. Then we have irregular bones. Now, irregular bones are things like our vertebra. They're such strange shapes that we haven't got them fitting into any other category, essentially. So they're irregular in shape, but they have a very specific purpose. So the vertebra are really strangely shaped, but they allow for a little hole through the middle for our spinal cord to run through. They allow for these spinous processes and transverse processes that basically allow for lots of attachments. So they have a very unique purpose. And then the final type of bone that you need to know is the sesamoid bone. And this actually means like sesame seed. It basically means like a seed that is amongst something else. So it means that you have your bone floating inside the tendon. And it's not actually the same as any other type of bone that we have in the body. And a good example of that is our patella, which is our kneecap. So now that we know all of the types of bones, we can then go and start learning each of the bones you need to know for your exam. And I would use this like a checklist and keep this checklist handy so you can learn each area and make sure that you understand exactly where it is. You don't need to know much information about that area, but make sure you could kind of touch that area, you could feel where it was so that you were able to put all this information together later. Now at level 2 anatomy, these are the ones you need to know. First of all, the cranium, so the skull itself, so the cranium, and that includes the jaw as well. So make sure that you understand that you've got the jaw, which is your mandible, and the cranium. Then for the spine, you need to know that it's divided into cervical, which is your neck, thoracic, which is where your rib cage is, lumbar, which is your lower back, sacrum, which is going to be like the flat bit at the back of kind of where your pelvis is, and then your coccyx, which tucks underneath, which is your tailbone. So you need to know each of those areas. Then for your torso, you need to know that there are ribs that make up your overall rib cage. And then right through the middle, you have your sternum, and that sternum is basically the breastbone. So they make up your torso. Then in terms of the arms, we've got the scapula at the very back. Now these are your shoulder blades. You then have your clavicle, which goes across the front here. This is your collarbone. You've got your humerus, which is your upper arm. your radius and ulna that make up your lower arm. Now with the radius and ulna, if you need to know which way round they are, if you go thumbs up, then basically your ulna is the one underneath. So U for underneath, U for ulna. Now, as we start working down through the body, we have the pelvis. Now, the pelvic girdle is actually made of 3 bones at each side. So you've got 3 on the left and 3 on the right. It's not one fixed piece. Now, the 3 bones that make up the pelvic girdle include the ilium, which is the big flat butterfly shape around the top, the ischium, which are sits bones, and the pubis, which is at the front. Now, that's near what we might call our pubic bone. So we've got 3 different bones that make up 1/2 of the pelvic girdle. Then as we go down through the legs, you've got the femur, which is your upper leg. You've got the patella, which is your kneecap. And I said about that being a sesamoid bone. Then as you go down, you've got the fibula and the tibia. Now the tibia is the largest, most weight-bearing part of your lower leg, and the fibula is a little bit smaller and it's on the outside edge. Then we've got the feet. Now to make up the feet, we've got the tarsals, which are these square kind of short bones that we have that make up around sort of the ankle and the top of the foot. Then we've got our metatarsals, which make up the sort of arch and bridge of our foot. And they go into the phalanges, which make up the tiny little toes. So we basically have everything all set out to understand our spine, our torso, our arms, hands, pelvis, legs, and feet. So you end up with understanding each of the sections you need to know for your level 2 anatomy. And that's all part of the bones you need to know. Plus then you need to know about the 2 skeletal systems and the types of bones that we have in our body. Now, once you've understood this, or you've got this as a checklist, work your way through. And if you need any additional help with this, obviously do reach out. But there's also our revision boot camp. Now, our revision boot camps are here to help you pass your level 2 anatomy exam. So I'll include a link to that so that you can go straight to finding out more about how we will guide you every step of the way. And if you've liked these videos, you'll love our boot camps because they're designed to keep everything just as simple. Outside of that, if you want to test your knowledge, there are 3 mock questions that you can have a look at and test your knowledge on today's content. But also you'll notice there's a link to be able to download lots more mock questions to help you prepare for your exam. Thank you so much for joining me today. Make sure you hit subscribe to our YouTube channel if you haven't already, and I will see you on the next video. Take care.
You